Welcome to Speaking of Pets.
We're the Novotny sisters from Cleveland, Ohio.
I'm Dr. Alice Novotny-Jeroman, a board-certified veterinary dermatologist.
And I'm not. I'm Janet Novotny-King, the doctor's sister, podcast co-host, pet owner, rescuer, and lover.
We're here to provide pet owners with science-based information to help them be the best pet parents they can be.
Here's today's episode, created just for you and your pets.
This episode of Speaking of Pets podcast is sponsored by Froggy's Golf Ball Retrieval. Don't use a mulligan. Let Froggies clean up your ponds while the golfers clean up their game.
Hey, Janet, isn't it kind of sad when our middle-aged and older pets are kind of having trouble getting around, and you see they're kind of getting skinny in the hind end, and your heart just goes out to them? Well, I listened to a wonderful webinar for veterinarians by Dr. Kelly Fishman, who I asked to be on the show today because I wanted to share what she shared with we veterinarians to all our pet owners, because she gave such wonderful insight into an integrative form using nutrition, state-of-the-art therapy, fitness, how to help these middle-aged to older pets still maintain a good quality of life. I wish there was someone like that for us, because I'm not getting any younger. A little bit about Dr. Kelly. She did her undergrad at University of California, Berkeley, by where you used to live, Janet. Her vet degrees from Ross University, went on to do an internship in Florida, like I am right now, University of Florida College of Veterinary Medicine. And she is the owner and founder of Strut Animal Mobility Services, and on the advisory board for Myos Pet. She is a veterinary acupuncturist and a certified rehab therapist. So this is our go-to person to help these middle-aged, and first of all, what is middle-age in a pet, be it cat or dog, and different breeds, and how can we help our pets? These pets are living longer, and we want them to have a good quality of life as they're living longer. So welcome, Dr. Fishman. I can't tell you how much I learned from the webinar I listened to that you did for us veterinarians. And I just want these pet parents that listen to our show to be privy to some of that.
Yeah, thank you for having me. I have made it my life's passion to try to spread so much awareness about dogs' mobility, because I feel like as veterinarians, we really forgot about it. You know, we looked at the kidney health. We looked at their how their heart was functioning, what are their liver values. We do this blood work every year, and you look at their eyes, and maybe there's other sort of things that are changing, but you're not really paying attention to their musculoskeletal system, meaning that the way that they move around their environment, their ability to move around their environment without pain. And
right.
So that's really where I come in, and I want to try to give our dogs the best possible, health span is what we call it now, where they're able to walk, without pain and have strength and live great, golden years.
Did you have an elderly pet that inspired you? I mean, what inspired you to, I'm in dermatology and allergy, but what inspired you to go into this field?
So, I think part of what inspired me was I was working in a cat clinic before veterinary school. And there's a lot of these geriatric cats have come in, and they were so arthritic. They were so, just sore. They weren't using their litter boxes. They weren't jumping anymore. They weren't playing. And you knew it wasn't behavioral, it was pain. And back then, before vet school, this was 15 years ago, there was nothing we could do.
Yeah.
There was still the pain medication for older kitties is really limited, but back then it was even more so. So I started to look at how about acupuncture as a tool to help manage their pain. And I got interested in that first. And then during veterinary school, I actually formed a pain management club because I was really interested in just helping me and my fellow students learn more about all these different ways to manage pain, acupuncture, massage, chiropractic, exercises, so much stuff exists in the human side that we were, as veterinarians, kind of late to the game on.
Mm-hmm. Sadly so.
Yeah.
So let's start with, I have an elderly pet and I haven't done anything, right? They're just getting old like me. How do I know when it's time to seek out services like acupuncture, physical therapy, etc.?
So
Because they don't talk to me, right?
yeah, they don't. And so what I say is I start to look for a little bit some changes in their behavior to like recognize signs of pain. And now as vets, we're trying to tell owners that we can start looking at pain signs is not necessarily like a yelp or a limp or a gimp, but in changes in behavior activity. And this has even become so prominent that some of the drug manufacturers are now taking some of their pain scales and their pictures. So if you look at, for example, Silencia, which is a pain medication that's prescribed for arthritic cats, they show pictures of a cat not being able to jump up to a perch like they used to do. They used to do it, and now they can't. They're not using the litter box. The owner, the pet mom, she just spent $1,000 doing all this blood work and checking to make sure there's not a urinary tract infection. It's not that. Nothing else has changed. What has changed is the cat is really arthritic. So, these pain scales that I would give to you for you to look at for your dog or for your cat are they're pictures. So it's really observing your animal, paying attention to what behaviors they have and then what's changing. And then it's up to you as a pet parent to kind of track that. And then you bring it to your vet and you say, hey, my dog's slowing down on their walks. My dog used to jump up into the car and now they're not. My dog was able to go up the stairs and now they're not able to do that. So those are all these subtle behavior, changes that are actually pain or weakness signs that, we're trying to identify now. And you just have to tell us vets because we don't know. We're not at home. And it's up to us to listen to you and then to do a really, really good exam to be like, where is it? I've ruled out all the internal stuff. Okay, it's something physical. Is it pain? Is it weakness? And so I think that your job as a pet parent is to start, again, just paying attention to those little things and just letting us know.
And what does physical therapy look like for a dog?
Yeah, so that's a great question. So physical therapy, what it looks like is we have a big pain component part. So it's a bunch of non-pharmaceutical ways to manage pain. And then we have a other big part of it, which I call fitness. And that fitness is muscle strength, cardiovascular endurance, balance, and body awareness. So we kind of have those two big areas that we provide our services to help make our dogs more mobile. And I can go on and on about it, but we have a lot of ways to manage pain in dogs that are just not pain medication. So heat, ice, acu,
A good point that you brought up in your webinar that I listened to was the mobility aspect. It's great to take your pet for a walk, especially the dog, okay? Because I don't know a lot of people that walk their cats. But I've also seen people that are kind of pulling the elderly dog, and I want to go up to them and say, I think this was too much of a walk for this dog at this age. So how do you get it right? And then at what age do you consider middle age in a cat or dog?
Yeah.
I know that's a loaded question.
What's middle age in humans?
I think 50. I don't know. I guess they say
It's
50.
like 40 and 50. Well, a woman lives till 85. That's average age, right? Life expectancy.
Unless they're a smoker. Okay, I won't get
Average
started.
age, smoker, drinker,
Yeah.
But average age is 45. So it's probably like 45, 50, right?
Yeah. 45.
So in dog years, depending, I know some breeds live longer than others.
Yeah, it's got to be by breed. So and again, this is just a rough understanding of like what I put together because it's not an easy question to answer. We kind of know as veterinarians, we're given a standard for geriatric and senior. Those are defined. If I could look up guidelines to say in the last 25th percentile of the dog's estimated lifespan. So a Labrador, for example, I could look that, but like, I feel like a really good way for us vets to start kind of noticing some of this earlier stuff as a way to be preventative and help prevent frailty in old age is to start paying attention in midlife. And again, so what is that in people? 45, 50. If you're a small breed dog, so you're a dog, a French bulldog or a dachshund, that's going to be about 10 years old. Now, our cats and our large breed dogs over 50 pounds are hitting that about 7 years old. So if you have a lab, that's 7. And if you have a cat, it's the same age, about 7, because we're thinking cats are reaching a senior age more about 11 years old. And then you have, if it's anything with my cats, they live to 18, and they're like,
Right. Same here.
super geriatric.
21.
Yeah,
19 and a
geriatric for
half.
half their life, which maybe we should change that because it seems they're living really long.
Yes. Well, the other thing too, I think there's certain, and I thank you so much for what you do, because I think some vets kind of just skirt the issue. I think a good idea when you go to your veterinarian is to say, I see he's getting older. What are my options?
Yeah.
So that you kind of force them to give you choices instead of, let's just give him a cortisone shot and we'll take the inflammation down type
Or no,
thing.
put them on gabapentin.
Yeah.
I even know
Well,
that one.
it has its use, but I know you're off, Janet. You're like on a anti-gabapentin thing lately since you read that article. But anyway, let me ask you this. So I know how to exercise a dog. How do you exercise a cat?
Yeah, good luck with that.
So there are a few things that you could do. You could certainly use one of those like exercise wheels. And then I just use a laser pointer. So you could use a laser pointer to get you to do a stretch.
Oh, right.
And then you'll never believe people. In rehab school, we have a whole bunch of exercises, or I have a big exercise program just like your PT does, right? And for dogs, I could have a video of a dog doing a squat, a dog doing a plank, or a dog doing a push-up. And then it even goes on. We have bunnies. So we have bunnies going over. They don't do the strength exercises, but a lot of them get back issues. So I've personally rehabbed bunnies with those.
Wow.
And those exercises may look like walking over a little pole to build up body awareness again, or hopping. And then we even have ones for birds. You know, sometimes like birds get really arthritic talons, so they have to do a lot of grip exercises.
Oh, like gripping stuff.
Yeah.
That's my problem.
But when you search the exercises for cat, there's only 2. It's like,
Okay.
like the dogs
It's a
have
laser
500,
pointer.
and like the cats are like jumping in and out of the box. Stretch
Wow.
them again.
You know, that's true though. Right.
Yeah.
Right.
Golfers always swing for the greens, but they don't always hit them. Every year, millions of innocent golf balls are recklessly sliced, chunked, and hooked without any consequence. Golf balls can have a significant impact on the environment if not properly removed from ponds and water hazards, harming aquatic life, contaminating water, disrupting habitats, and aggravating golfers. Plus, golf balls do not biodegrade and can take 100 to 1,000 years to break down. Once they do degrade, they release microplastics, zinc compounds, and rubber fragments. That's why Froggy's golf ball retrieval service is so valuable to the sustainability of golf courses throughout the Midwest. Froggy's efficient retrieval system helps reduce environmental contamination, waste, conserves resources, and enhances the golfer's experience. Plus, they offer financial benefits. Froggy's pays per ball for any golf ball pulled from your ponds, no matter the condition. Don't use a mulligan. Let Froggy's clean up your ponds while the golfers clean up their game.
Hi everyone, I'm Larry. Some of you know me as Grandpa Larry, and I run Larry's Animal Safari on YouTube, where we share sweet and educational videos about baby gorillas, zoo animals, and the amazing teams who care for them. If you love animals of all kinds, I'd love to have you join us. You'll meet little ones like Jamila and Kayembe, learn how zoo families grow, and enjoy real moments that bring joy and curiosity to animal lovers everywhere. Just search Larry's Animal Safari on YouTube, or click the link in the show notes. New videos go up weekly, and each one supports awareness for animal care and conservation. Thanks to Speaking of Pets podcast for all they do. Now, let's get back to the show.
Is there anything people can do nutritionally for these should I call them middle-agers or aged pets? I hate to say middle-agers, but as our, I don't know, as preventative, is there anything nutritionally we could do?
Yeah, it's a great question, because I really feel like a lot of times as veterinarians, we're very guilty of saying joint supplements, joint supplements, joint supplements.
Yes.
And a lot of times I come in and I start to read through a history, and they're on 3 different joint supplements. Like they're overdosing on glucosamine, which
Oh my goodness.
we don't even have much like evidence for. So what I like to say is, from a supplement point of view, I say I want to do things that are anti-inflammatory, all over good, right? Do
Right.
something that's good for the joints, and then do something to support the muscle, because as they're aging, as they're going into, from adulthood to senior, they are losing muscle. They are getting sarcopenic just as much as we are. And it is linked to frailty and increased euthanasia at the end of their life because their legs can't get up. So it's
Right.
really important to maintain muscle. So what I always say is like omega-3 fatty acids, like your derm, like,
Okay.
like benefits of that. Make sure
Right.
you're giving a dose high enough, because I know the derm dose is way lower than the dose that I recommend for my dogs with arthritis, right?
Right. Right.
Yeah, so high doses omega-3s, like that's what I take myself. Also doing things like proven joint supplements. So again, high doses of omega-3 fatty acids and type 2 undenatured collagen have the most evidence.
I have read about that.
Yeah.
That's fascinating.
Yeah, so they did a cool study where they had dogs. So what they did is they had nice, healthy young dogs, and they basically sprinted them. So they would ran the dogs over and over, and they looked at the cartilage at the end of doing that, like what the inflammatory mediators and the type 2 collagen seemed to be the most protective for that collagen. Yeah, and then, I've started working with Mayo's Pet, which
Yes.
has a product called Fortitropin. And
Okay.
why I started to do that was they actually are one of the only supplement companies that has gone ahead and put the time and money into studies in dogs, cats, and
Yes.
horses. So we have,
So important.
and they're good studies. They are like
Yeah.
placebo-controlled, double-blinded,
Yes.
like best top quality studies of 100 dogs. Like you never
Yeah.
get a study of 100 dogs in veterinary
Right.
medicine. So it's like, if I'm going to stand behind and recommend something, like it has to have evidence behind it. And
Right.
so that's what I say. And we have evidence, talking about frail dogs and then moving into animals becoming seniors. Like we know that if we start them on something like Fortitropin or Mayo's Pet, they're going to have a better quality of life. They,
Yeah.
had better load studies and all sorts of things. But basically it does improve their quality of life because they don't get weak. And we're all taught the same thing. You have got to like maintain muscle mass as you age. It's
Yeah.
a really important part of healthy living.
Well, and I think what you said about a company that, a supplement company that actually can provide you studies, because so many of them have flashy covers and make all these claims, which legally they're not allowed to do. And we all know that FDA doesn't check on supplements. So it's so important to stick with a recommended supplement by a health professional, be it your veterinarian or a human MD. And I don't mean to put you on the spot, but I was reading the other day.
But I'm going to.
It was no. Well, I want her opinion on this, Janet. I think it was on Facebook. Someone was saying there's something called an Androva heating pad.
She'll know.
Did you ever hear of that?
No.
What is that?
Well, okay. So the whole gist of the story was they had an arthritic small dog, and they said what we don't consider is heat, and sometimes heat on a joint makes you feel so much better. So they did their own little experiment with their own dog that probably it was a Bichon and probably had some sort of hip luxation problem, like Perthes disease, if you will. And I thought about that, and I thought, kind of like when you're sore and you put a little low heat, never, and I'm not, okay, so right now I'm not telling you to use a heating pad on your pet. This Androva heating pad apparently like magnifies the
It
patient's own
reflects
heat.
body heat back to the joints with no
Thank you.
electricity
Thank
or
you.
cords.
But that kind of made sense to me.
Yeah.
But maybe I'm just going down a rabbit hole with that too.
No, I mean I recommend it all the time. And
Oh, good. Okay.
it's also important to realize that like there's stages to arthritis in dogs, right? So you sometimes have a dog that has an injury where you need ice. And that could be maybe when there's really the acute injury, or when for example, I'm thinking of like a cruciate or an ACL tear in a dog.
Okay.
When that first happens, that's a juicy joint. Like it is sore, it is swollen, it's hot. Like that is ice all the way. But then what happens over time, you've either gotten surgery or the knee has stabilized itself and you've done some rehab. And now you have a senior. And that joint is arthritic, but it's arthritic and inflamed in a different way, where the joint is actually, it's when you have a lot more like bone on bone contact, and then you also have a lot more, inflammation associated with like this synovium and like other sorts of things. So it seems like as they get there and you start to get that was all that vet talk, but I would say to an owner, when you have these joints that are creaky and they're, you can see this stiffness, the heat is really a good idea. And yeah, I like the idea of using some kind of, heating device. And I would never recommend a heat pad, especially around a dermatologist, because I don't want to burn skin. But I actually love those little lavender eye pillows that people can get from, because they're not too heavy. They go around the joints. You could put on your dog's neck. They don't get too hot. They smell good. So they're
great for styes in your eyes.
Yeah,
too.
like those are my go-tos that I typically tell people to do.
You know what's interesting? I looked up just because I didn't know what it was. Undenatured collagen supplements.
Yeah.
It's derived from chicken sternum cartilage.
Yeah.
Yeah.
Fascinating.
That's cartilage. Yeah.
Really interesting, huh? So we're looking for physical changes, behavioral changes in the pet, and then when you see improvement, what is it like? Like for the pet?
So like out here, they have more pep on their step. They are wanting to grab their leash and go for walks. They're not wanting to go home. They're walking for more steps. So I actually have pet parents, and now they're not very accurate, but sometimes they'll use like a pedometer. Yeah. And they'll know how much they're, and there is some error with those, and they're not perfect, and they're not great for scientific studies, but they're good for like home use. And their dog is walking farther with more vitality, despite it being, it just snowed and it's really cold out. Like they had tons of energy and wanted to do, their walk. And even when I teach people to start doing exercises with dogs, so all of my pet parents know how to do exercises. They know how to actively stretch out their dog. They know how to massage and ice and heat. But when they start doing exercises and the dog is feeling good, like I heard of one dog, he would actually go to his little doggy, his exercise equipment and start barking. He's like, all right, time, like do exercises. I'm ready, Mom, ready. She's like,
I bet he got a treat after that.
Yeah. Yeah. And it's all very positive. When we do it, it's funny. I've now worked in rehab since like 2013, 14, but I've now come to realize like there's so much of rehab is behavior, because you have to really like, kind of suss out what is a behavior versus like a pain, how to train dogs, how to always do like low stress handling, how to do, there's so much of that like you have to do as a rehab veterinarian, because you're not going to be able to get in and massage your dog if they're not relaxed and if they're not calm. Yeah. Do a lot of stress handling and a lot of, training too.
Do you teach a lot of pet owners how to do massages? Is that hard to do?
No.
Hard to teach?
No, not at all. And I think it's the best, one of the best things that people can learn how to do. And I'm not anything special. Like I do, rehab, but there are people online who are dog masseuse, like massage people who are accredited and like, really do a good job of sharing their techniques. But I just teach basics, how to like approach a dog. How do you move it from a state of, being more aroused to relaxed to being a relaxed? Like, for example, like taking your hands and doing big circles on their chests to kind of calm them down, turn down the lights, remove the distractions, add a diffuser and some essential oils, you could play Through a Dog's Ear, which is a calming soundtrack you could find. So you start like that, and then you start with like kind of smaller movements, and then you go to the painful area, and you could do a stroke, you could do a little bit of a kneading, you could do a tapping if you like. Bella, most dogs don't like that. So there's a lot of different techniques that people could use to massage their dogs at home, and I absolutely teach it because it's a great way to make your dog feel good, and then also to bond with your dog. Especially in the night, everybody's tired, it's sitting in your lap. Like you could actually just do I'm just gonna do a little dog massage, like, make my dog feel good. And as long as people like, I think teaching the pet parents like where the body parts actually are, it's like,
right,
the knee is not front end.
Right. The wrist. Right.
But
well, and also it sounds like you may be able to not use as much drug therapy when you can use some of massage therapy too. Because I think a lot of it is, oh, can't I give him a pill and make him feel better? And yeah, but those pills have side effects too.
Yeah. Yeah, definitely. I mean, you probably felt the same way with like doing derm and like thinking about how, like feeding clean diets or making clean clothes.
Absolutely.
Like just like how you could change so many things without having to like turn to steroids or turn to like other things. You're like, if I could just kind of, you know, everything's really multimodal is what I guess I'm trying to say too. You know, just like dermatology is where you have to control diet, you have to control environment, you have to like good flea and tick medication, like all those things kind of go together to like help, or gut health even, gosh, right? You know, all those things kind of go together to manage a dog's like allergies and how they're doing. And the same thing with our you know, older dogs that are painful and slow me down. Like I really think about, when I think about arthritis, I say, okay, like I have a bunch of like little errors around me. I think about joint supplement. I think about muscle supplement. I think about weight loss. I think about exercise. I think about, of course, pharmaceuticals, but other things, cold laser.
Sure.
Yeah. And then also changing their home, like making sure.
Absolutely.
Yeah. Raise the bowl, making sure they're standing on an anti-fatigue mat under their bowl, you know, all those sorts of things like all go together to make the dog just feel better. And a lot of it, people don't realize they can do it for free at home. Like, so sometimes like when people have consultations with me, you know, finding a rehab vet is not that easy. There's not that many of us out there, even there are more and more all the time, but it's not as many as a general practitioner. So sometimes they'll just get a consultation for me because they've come from far away or there's a, you know, an affordability issue. So I say to them, just have a consultation. I will teach you how to do some of this basic stuff. And then everything is kind of, you could do a lot of this stuff for free at home by yourself. Exercises are free. It's just your time, you know? So,
well, and I had quite a few owners that would sleep downstairs on the floor with their pet as the pet got older. Because it was satisfying for both parties involved. I was going to ask you, did you ever have any pet owners that put in the stair climbers for the pet? You know, where you sit on the thing.
No, the best I ever had was a little Chihuahua, and it was back when I lived in San Francisco, and we had these really, you know, 3-story Victoria's house calls on. So the dog had to go. The tiny little dog was expected to go up to a gigantic amount of stairs, and the stairs were like from a 1910 house, so they were very steep and very short. And so they put up, actually, they got a custom-made dog ramp that went right next to the stairs with, like, fake grass on it. And then it had lighting.
That's so cute.
And she got grass. So she'd, like, go zoom up it and then, like, look at everybody else like, gosh, you humans are taking a while.
Well, I remember it was a simple thing when our Dexy was 19 and a half and a cat. And, you know, when they get older, they stop grooming.
Yes.
Because they can't. So I would take like the unscented water wipes and just wipe her down. And you could just see it was like she had gone to a spa. You know what I'm saying? She felt cleaner. She felt fresher. She still looked
Janet, that's a good point because I don't think people check that butt end enough on
nobody
older
wants
pets.
to check the butt end.
I do.
I do. It doesn't bother me, but yeah.
No, Dr. Fishman, you know, as vets, we've seen that rectal area caked with poop and hair, and no poop could come out because nobody looked back there.
I know.
Yeah.
Okay, I have a weird thing for you two veterinarians. Every time Libby, our golden retriever, gets into the back captain's seat, in my back seat, it must be the way that the seat is formed, her anal glands express. It is, I'm not kidding you. We'll be driving to go for a walk and we're like, yep, there they went. And the car stinks. And I have to come home and clean it with that Nature's Miracle, whatever it's called. I am telling you, it's got to be some kind of configuration that makes her
Maybe she's just nervous.
I don't know. She gets in the car a lot. But it's become like a joke.
Yeah. Well, I don't know. Like anal glands are not I tried. If I see anal gland problems, I'm like, oh no.
I only deal with impacted ones. So if they release, I'm happy.
Yeah. Well, I did hear, maybe you know, Alice, like that feeding like a lot of like psyllium can really help and probiotics.
Fiber. Yes.
So maybe she needs
and
fiber.
a big container, and Janet takes it too. I should go show you, of Fiber One
Fiber One.
cereal. The squiggly, not the
The
flakes.
sticks, I call them sticks.
That's that or psyllium are the latest things.
Yes.
So, Janet and I are constantly in search of a good price for Fiber One.
It's so expensive.
CVS is too high.
Yeah.
But anyway, and Janet's GI doctor, not to get personal, just
Right.
advised you. And I said to Janet, who told you about it first?
But
Yeah.
guess who's allergic to psyllium?
Gidget and Annie are on Fiber One.
You're allergic
What?
to psyllium. It's just
I'm allergic to psyllium. They put me on psyllium and I was on it a week and I had head to toe body rash. Remember?
Wow.
Al?
Oh,
Oh yeah,
no, I don't
it was
remember.
bad. And it's rare, but it comes from a tree bark.
But see, I think fiber's fabulous.
Yeah.
I think fiber, and of course the microbiome is the big hot topic now, but I've had, just to regress, I remember seeing a police dog that was very greasy, very yeasty. So I put him on the standard hypoallergenic diet, like we're all told, Kelly.
right.
He got worse.
Oh.
You know what I did? I put him on high fiber. It dried up all that oil. He was like a new dog. So it's not, how can I say, sometimes you got to use the noggin and not do as you're told,
Right.
if you know what I'm saying.
So my human gastro was really interesting.
Oh, here we go. Back
All
to
right,
you.
back to me. The human gastro, he said to me, everyone's all about supplements and probiotics. He said,
Yes.
fiber is like disregarded. And he said, I think it's just as important
It's so good.
as taking a supplement. And so I eat
Yeah.
that crappy twig stuff every day, which by the way,
It's
is
like the
good
new
for you.
protein rage.
Exactly.
Protein. And next it'll be fiber.
Yeah.
Marsha.
Someone just needs to make a good fiber. If anyone out there wants to give me a % of their company, but a little
Yeah,
fiber
same here.
for dogs, like a little psyllium thing, because I'm not sure, Alice, you saw this study about how dogs with stress colitis, or basically
Yeah.
they compared metronidazole, which was
We had Dr. Radinsky on
you're
talking
already
about
know-
that.
Yeah, you guys are already pros. So that's what actually I do. So a lot of when I have dogs who, for example, if I have to use swimming therapy with them, underwater treadmill, and anything like that, and we don't want them to go number 2 and they get a little stress colitis, like a little stress diarrhea, or a nervous belly, like more polite. I actually will have the pet parent start a psyllium husk a couple days before, and not even. I mean, it's all anecdotal, and I don't have many dogs, so 100% works.
Right.
Like really good.
Yes, I think fiber, and one of the things I'll never forget when I talk about food allergy on webinars and podcasts and stuff, you'll love this, Dr. Fishman. You'll be in the room with a boxer, and the gas is just like, and the owners just chuckle, and I'm like, you know what? This really isn't funny. I said, because something's going on here. Your dog is not utilizing everything it's taking in. How would you like to be that gassy? And I get that they're laughing about it because they're nervous and they're embarrassed, but it's a problem. And we either need to look at what's going on in there or add more fiber. But 9 out of 10 times it is the fiber issue, by the way, I think. Yeah.
Golfers always swing for the greens, but they don't always hit them. Every year, millions of innocent golf balls are recklessly sliced, chunked, and hooked without any consequence. Golf balls can have a significant impact on the environment if not properly removed from ponds and water hazards, harming aquatic life, contaminating water, disrupting habitats, and aggravating golfers. Plus, golf balls do not biodegrade and can take 100 to 1,000 years to break down. Once they do degrade, they release microplastics, zinc compounds, and rubber fragments. That's why Froggy's golf ball retrieval service is so valuable to the sustainability of golf courses throughout the Midwest. Froggy's efficient retrieval system helps reduce environmental contamination, waste, conserves resources, and enhances the golfer's experience. Plus, they offer financial benefits. Froggy's pays per ball for any golf ball pulled from your ponds, no matter the condition. Don't use a mulligan. Let Froggy's clean up your ponds while the golfers clean up their game.
Hi everyone, I'm Larry. Some of you know me as Grandpa Larry. And I run Larry's Animal Safari on YouTube, where we share sweet and educational videos about baby gorillas, zoo animals, and the amazing teams who care for them. If you love animals of all kinds, I'd love to have you join us. You'll meet little ones like Jamila and Kayembe, learn how zoo families grow, and enjoy real moments that bring joy and curiosity to animal lovers everywhere. Just search Larry's Animal Safari on YouTube or click the link in the show notes. New videos go up weekly, and each one supports awareness for animal care and conservation. Thanks to Speaking of Pets podcast for all they do. Now, let's get back to the show.
I wanted to ask you about treadmill. Do you use that? Is that mainly for stifle joints, for cruciates or hips, or what's the indication for treadmill?
Yeah,
Underwater treadmill.
Yeah, so a couple of things I use it on. I use it on my patients who just had spinal surgery or for some other reason can't walk at all. So it is a great way to try to build back strength in dogs without any strength at all. And one of the things I learned, and I don't know, this was kind of not necessarily proven, but what an old neurologist said to me when I was at UF, he said,
Was it Dr. Fenner?
No.
Okay. No, sorry, Dr. Fenner, I love you. Not that you're old.
Yeah. So, but what they said was, and I'm blanking the doctor's name. I don't know why right now. It'll come to me.
Okay.
But so what he said was actually sometimes if you have a dog that can't walk at all, so say they have the ability to move, they have motor function, but they can't actually move at all. They just had spinal surgery. They could actually start to swim first. So I'll put them in the water with a vest, and I start to do like a little bit of stimulation to their tail. And for some reason, out of nowhere, they'll start paddling, doing a doggy paddle.
Oh, that's lovely.
Yeah, so that's a great way to use it to try it. And then as those dogs are so weak, they can't walk at all. They're in a cart. I put them in the support of the water, and then they can actually walk. And it's a great way to get them to walk again and build strength. And then the other top two that I like are dogs with hip issues. So we could use the water at a certain level and kind of like speed and the speed of the treadmill to kind of fully extend out the hip. So it's a really, really good way to get it, like actually move the hip in a very functional way to get extension. And the other thing is actually one of my patients this past week, his name's Conrad. He's like a senior, so he's about a 9-year-old, a silver lab. He's huge, like a gigantic lab. He's like too big for a lab, but he has arthritis. He's had both of his knees done. His spine is full of arthritis. His hips have arthritis. His elbows, his feet, like everything. So what I do is I put him in the tank and I kind of fill it up to like right above his shoulders. And then I put the jets on, and the water that we use in rehab, it's like those pools at the gym that the people work out in. It's warm.
Yes.
And so he just sits there and he floats and the jets are on and he catches his ball and he's really, really happy. So those are things I personally use my treadmill for. There are a lot of different ways to do, other that we've learned in rehab school, but those are like what I use mostly.
That is so cool. I mean, really, I remember, and I graduated long time ago, way before you. We really didn't talk at all about rehab. And that's so sad.
But you know what? No one did. I think physical therapy in the
Yeah,
past 20 years for
you're right.
humans and pets, it was unheard of.
Yeah.
Yeah. My husband's father was a physician, and he was like, physical therapy, old school.
Yeah.
And honest to God, it has saved my life so many times. And improved
Yeah,
my
you're
life.
right. Yeah.
I just think it just wasn't, there wasn't a belief in it.
Yeah, I think you're right. It just was an area never looked into, I guess.
Yeah.
And when you think about it now, I love that in veterinary medicine, we're not quick to give a steroid injection into a joint. Like if you and I went to the doctor now complaining about your elbow, we kind of investigate and work through it instead of, we'll just give this and then call me in 2 months type thing. Which I'm very proud of our profession for that, because it's kind of like Dr. Fishman when people say, well, what causes cancer? I'm like, oh my God.
Oh my God.
Because if I knew that, because I don't think people have the time to ask their human MD that because they're in and out so quickly. But we're kind of expected to address that.
Yeah.
Wow.
Well, when we have a lot of, I think the other thing is, for example, someone who just had a steroid injection and then some other stuff in my shoulder. I think the difference is that when I have a dog and I want to start talking about like putting stuff in the joints, and certainly I do reach for steroids when we have an old creaky arthritic joint.
Sure.
They feel good. But
Yeah.
I could also talk to someone who has like a 4-year-old lab, and I could say, guess what? I have PRP, I have stem cells, I have other things that like, Spring is like another company that's doing like a lot of biologics. Like, I think that's actually one of the areas where, as veterinary medicines, I think because a lot of that regulatory pressure is off our backs, and we can get things a lot more affordable, where I can give someone a PRP injection for $300. Versus when I talked to my doctor about it, he's like, great, your insurance isn't going to cover it. And it's $1,000. And I was like, oh.
Yeah.
So what's like cool? Like what's coming up? What do you see in the future of pet rehab?
Well, PRP for sure.
Yeah.
What's PRP?
Yeah, that's a really good one. I think, a lot of the regenerative medicine. So it's really gone to, we really want to try to start, again, in midlife or middle age. And we've really realized, just based on like what happens in people, that if you could be really preventative, if you can start keeping your dog strong from as an adult, they're going to be less frail later on. And there was like a million ways to do that. Nutrition, exercises, keeping them lean. Like, we know these things kind of exist to like that you could do as a preventative in middle age to actually make your dog live and feel like, live longer and feel better. So I think that's certainly like that. And then part of that prevention is just like we were talking about, like all of these like regenerative techniques we have that, from the stem cells to the PRP, that they just don't have necessarily in human medicine as much. And then, I think that's the big one.
Yeah.
That's cool. So
do you see many cats? Because I can't imagine, cats hate leaving the house. So do you see many cats in your office? Because it's tough for them.
Yeah. So actually when I started Strut, I moved away from a clinic, and I do everything at home. So
cool.
You could pull off my car, and it has an exercise ped in it. It has dog jumps.
I love.
Yeah, it has dog jumps, has my acupuncture machine, has my laser. I bring everything. And then I also rent an underwater treadmill from a local veterinary hospital that wasn't using theirs. So I actually will do underwater treadmill sessions for the dogs who need it. But cats actually do have probably about like 5% of my caseload is kitties. And they're arthritic, and they just need acupuncture like for 10 minutes.
And they'll lie there? They'll lie there?
Sorry?
Will they lie there while you're doing it?
Oh, yeah. Like cats, if you have a cat patient that's a good cat patient that likes acupuncture, it's your best patient. Wow. They are loving, compliant. They just sit like a little loaf, and they're awake. They don't ever fall asleep like a dog does, because it's not really their type of animal. But they'll sit like a little loaf, and they'll be like, okay. And then they tell you when you're done. Like, they're not like a dog. Like, they like look at you. They're like, okay, I'm done. Or they get up, or they move, and you're like, okay, cat's done.
Not in this house.
Yeah, they certainly pick their sessions. Cold laser is really great for them too. So
cold laser. Talk about cold laser, because that's something we never learned about in vet school. Well, did you learn about it in vet school either, or after vet school?
I learned about it. No, I think I did. Yeah, technically in vet school. Yeah. So what cold laser is, or they've gotten away from saying cold laser. I don't know why. Who doesn't matter?
Because people assume laser was hot.
Yes.
And now, true.
And now what's happened is everybody's really in this vanity kick. We all know about lasers that are not so hot. We use them on our face.
Right.
You have like those masks now, which I'm maybe having. It's not a laser, but it's light therapy. So
that red thing.
The red thing,
yeah.
So what laser is, it's a wavelength of light that has been proven to kind of go and activate the mitochondria. And in activating the mitochondria, it helps to speed up healing. For example, it's really good if you have a non-healing chronic wound. You do cold laser, and it really helps to improve wound healing and improve the wound overall. So kind of that's the way it generally works. But for some reason, which is not completely and fully understood, if you apply the cold laser to arthritic joints, it helps to relieve pain. Also, how they don't understand how chiropractic or joint manipulation, so a chiropractor moves a joint in a really forceful manner with the point of making a noise, right? Or it's the strongest rate of movement. But physical therapists will mobilize a joint in a more gentle way with the goal of relieving pain and then increasing movement in the joint. So, but we don't really know how that works. It's kind of a mystery. Like, why is it so
Yeah.
pressing in moving a joint that's supposed to be arthritic and sore?
Yeah.
Why is it like, why is moving that so helpful and, feel so good? It's a little bit something we don't 100% understand. So the whole mechanism of laser is not known, but it helps with, for sure, a lot of skin stuff and then with painful arthritic joints.
The only thing I can think of about the moving of the joint is in case you would have nerve entrapment.
Yeah.
You know what I'm saying? And
Yeah.
that would take care of that.
Yep.
But that's, as a dermatologist, that's my 2 cents. I have no clue.
Yeah.
It's fascinating to me though, because you read so much new about it all the time. I love that it's being like all this information is being uncovered that could help not only people but especially pets.
Yeah.
I'm
Actually,
getting one of my Goldens right now.
yeah, actually the fascia, like I think that's going to be the next thing.
Oh,
It's fascia. I agree.
Is fascia.
Oh my
Yeah.
God, fascia.
I did just a giant book came. I just ordered. It's like the dog and cat fascial system. Dog and cat, dog and horse fascial system. And
Oh,
it's like
horses.
this
Do you,
big.
I bet you do a lot of horses because look at horses are, remember in vet school they told you horses are 4 legs and a uterus.
Yeah.
Because those are the areas they have problems with.
Oh, yeah.
The legs, Janet, there's always some
Well, all that
lameness.
weight is on those little.
I know, on this, like this.
Yes.
Yeah.
Yeah. So sad.
Wow. Well,
Do you
Kelly,
do a lot of horses, Dr. Kelly?
No, when I was at UPath, I did a couple. One day a week, I would go do farm and acupuncture horses. But I, in my area, I live in this area of Pennsylvania, right by Bolton, UPenn's vet school.
Yeah. I know where you are.
Yeah, and there's a lot of really good horse veterinarians
Yeah.
out here who do acupuncture.
Yeah.
Yeah.
So, yeah, I leave it to them.
Yeah. No, I don't blame you. And I'll tell you, horse medicine, to keep up with that, there's a lot new going on with that too. So it's so hard to stay up on everything.
Yeah.
you guys got a lot of different animals to take care of.
Yeah, we lots of
Birds,
different
dogs,
species.
cats,
Right.
a lot of species. So,
Yeah.
Dr. Fishman, I got to ask you the question we ask all of our guests. What is your pet peeve? It can be about humans. It can be about pets.
Saying age is a disease. That really gets me.
Yes.
Oh,
I agree.
interesting.
Yeah, saying
Yeah.
that.
You know, when I go to a human doctor, I'll say there's 2 3-letter words you can't use: age and old.
Yeah.
Out of your vocabulary.
Yeah. And I think
they look at that numerical age and immediately go, ugh.
yeah.
You know?
I know they do.
They
Or
do.
he's slowing down because he's old, or she's not, like playing with us anymore because she's old. It's like, well, really? Like, have you checked out
Yeah.
the dog painful? Is the cat weak? What's going on? And
That's a cop out, I think. Don't you think?
yeah, it is. And just
Yeah.
and even if they're veterinarian, and I don't think any of us veterinarians really do this, but if I heard someone say like, oh, your dog's just getting older and like that's just how it is, and then not offering anything, like you said earlier,
Right.
Alice, like not saying like just I just hope pet parents are aware from me coming to these podcasts and like talking about this. It's like
Right.
just know like that there are rehab vets out there. This is what we do. We
Yes.
want to make your dog or cat feel better, and like there's so much you could do, and it doesn't have to cost tons and tons of money.
It doesn't. That's the thing. It doesn't. I'm helping out. It's called Silver Snout Senior Dog Rescue. And they have all these teeny little dogs that like the owners died or went into a nursing home, and they're allowed to live out their lives there. Now they can be adopted out, but there's some tripods there. There's one that came in so matted that they still are working on. They have to give her a sedative to try to clip the hair. And I'm trying to help them get things less expensive than what they're paying for something.
Yeah.
I mean, they don't know. Like you said, Kelly, they just don't know. And sometimes it just takes talking to one or two other people to gain the knowledge that, oh, I can do this, or I can do this for less, or you see what I'm saying?
Yeah.
Yeah. There's always possibilities.
Yes. Yeah. And I think, moving away from now, a lot of us veterinarians, I think for a long time, we're really like, well, this is the way you should do it. But now it's like understanding, like offering that kind of spectrum of care where we have a lot of different options and there's a lot of different things that people could do. And That's also,
Well, and I think, getting back to the supplement thing, I think they need to go by recommendations of their veterinarian or health professional, because there's too much crap out there.
Yeah.
Just before coming on today, I saw on one of my human medical pages, one of the supplements has been recalled because it has meloxicam in it. Meloxicam is a non-steroidal anti-inflammatory and this was a human supplement. And meloxicam can cause strokes in humans and heart disease.
I was on it.
Yeah, there you go. Back to you again.
Back to me,
But
one of my surgeries. I
I'm
was on
just saying-
meloxicam. I felt like crap on it.
this is why you want to stick with a company that either your veterinarian recommends,
Right.
or that's NASC approved or Consumer Labs approved. Absolutely. Right. And with some evidence base behind it.
yeah.
Kelly,
Right.
one of my favorite quotes is, "It's an attitude, not an age."
Yes, exactly. Or a catitude.
Yeah,
Attitude
Yeah, exactly.
being a catitude.
Yeah,
You
no,
should see the one sitting on the couch over here.
yeah.
with the hanging belly.
Yeah.
Hey,
The supplement
hey.
thing, I think it's just hard, because and it's not people's fault, because if you think about the marketing and that
Yeah.
has gone behind a product, a lot of times,
Oh, yeah.
they've spent no money in proving that the supplement works, which costs a lot of money, takes a lot of time, but they just have great Instagram ads. Like I had one of my pet parents who I've worked with her for over, a year, and she sent me the picture of the supplement. She's like, "Do you think this works?" And it was 3 pages all about I'm going to fix your dog, and the dog has weakness, and the dog does this. And it just had all these crazy claims. And I was like, but what isn't?
Yeah.
And then they
And they've never seen the pet. Right.
yeah, and then I went to go look at what the supplement is, and then it just gave me a bunch of papers that weren't even in dogs. So I'd say, do that. When you look at these supplements, try to be what if the paper's on? And the papers were if you looked at them, nothing was in a dog or a cat. So it's don't use it.
Right.
What are you trying to do? And she's like, "I'm just trying to build strength in my dog." And I was like, "We know how to do that.
Yeah.
You exercise, muscle supplements, build muscle mass, we can fix that. It's not this weird dropper thing that you take 2 times and it's a miracle work. It's we have
And plus, if it worked, we'd know about it.
yeah.
You know what I'm saying? I remember, and I love that clients are trying to help their pet. I love that. I would get the Tupperware container of all the meds and
my
supplements
God.
that the patient's on. And obviously they're not working because they're coming to see me.
Yeah.
For allergy or skin. And same with you, with rehab and joint issues. And you've got to give them credit. They're trying to help. They just need to be steered in the right direction of education.
Yeah.
Well, but don't forget now, you guys, you have influencers.
I know.
We're making
I know.
money from those companies and just.
But can I tell you,
companies.
how come every day I'm seeing an influencer dead at age 35?
Yeah.
Good question.
They don't know everything.
Let me ask.
So, yeah. And I think that's it. Because it's really powerful. I mean, your phone
It is.
Yeah.
I get influenced by everything. I have to tell my partner, it's I'm sitting there and I'm like, I think I need this pan. I'm like,
Yes,
it's like hair wrap. I'm so gullible. I'm very susceptible to marketing. And so
Yeah.
I have to be wait a second. I'm ordering all these things. I was like, wait,
I know.
doing this. And then it's really kind of crummy, because then your phone is listening to you. And 2 days later, when you've forgotten about it, it's hi, there's a sale on that thing you did.
I know.
Hey,
You're ordering those pots and pans that are,
yeah.
probably full of lead or something.
At 2 a.m.
Exactly.
There's a lot of ordering going on.
I know.
Well,
It's
I
really
was at a
tough.
funeral and I had my cell phone in my pocket.
You're at a funeral?
I was at a funeral,
Did you-
memorial service. And I had
Oh,
my
okay.
cell phone, and the woman next to me had this super cute handbag. It was one of those Sportiva. Is it called Spartina? Spartina.
Spartina.
It had a
Out of
blue
South
sign. I'm like,
Carolina.
oh my God, that's so cute. She goes, oh, it's Spartina. Da, da. Do you know the next day that showed up in my Facebook feed?
Yeah.
I'm telling you, it was listening. So my girlfriend took her cell phone and was going, Whispering Angel Chardonnay or whatever it was, because she wanted to get a deal on it. But honest to God, it was listening to me.
Yeah,
It
that's
was
scary.
I did try to do that with my boyfriend, where I was emerald rings.
4 carat,
Yeah, exactly.
yellow gold. See, we
Now
got
tell us,
Thanks,
what
Rosemary.
pets do you have? Kelly, what pets do you have?
I currently right now just have one cat, named
Aw.
Nelson, who's 11, and he was in here probably somewhere in my office, but
What color is he?
he's all white. So he was white when
Oh.
he was a baby, and that gray faded, and he's all white, and he has arthritis. So I have him on Solencia.
Yeah.
He refuses to take fish oil. He will not take.
Oh, yeah.
I
Yeah.
tried. Some cats are fine with it. I have him on. I tried to do a CBD, like a cat Elvet.
Yep.
Yes.
It's a really
yes.
good, high quality CBD that has evidence and is proven. He refuses
Yes.
to eat it. And then I have him on the Fortitropin. So Myos Pet makes a feline product that's been shown to build muscle, lean muscle in cats with kidney disease. So she's a stage.
Is it
He's staged.
is it flavored?
No, well, it kind of, no, it's not. And it kind of smells very fishy. So Nelson,
Okay.
in addition of arthritis, he has stage 1 kidney disease.
Okay.
So I also have him on the Fortitropin, which I was worried about because I was like, is Fortitropin, which is from fertilized egg yolks, is that going to ping his kidney values?
yeah.
Actually, I was really glad they did a study in stage 1 and stage 2. Not a study. They did it. Basically, they just looked at numbers. They are going to investigate it more. But what they did is they actually looked at stage 1 and 2 cats with kidney disease, fed them the Fortitropin, and they actually didn't see any worsening of their kidney values.
Oh, good.
Well, I don't have them on a kidney diet, and maybe me putting more supplements on it or giving him supplements would change if I had him on a kidney diet, but I don't. So right now I just have him on his kidney food. I do the Fortitropin, the Myos Pet. I sprinkle the top of there for his muscle. So he's very well muscled. And then I do the Solencia, which I just started because I was waiting to as long as possible to use it. And he really started to need it because he was having problems jumping, I noticed. So.
And is that a monoclonal antibody? Okay.
Okay,
Yes.
I have a question, Alice. What about that liquid martini I give my cats? Isn't that for their kidneys?
Oh, Janet has hers on HydroClear
Hydroclear.
to get by Purina.
Oh.
It gives.
Oh.
Wait, what is it called, Janet? Is it HydroClear?
Is it
Hydroclear. I guess it's
Hydrocare?
it's
HydroCare. So anyway, it's
Hydro something.
tell her about that, Janet.
Well, I started it because another vet that we had on was talking about how they don't
Dr.
get
Debbie Greco was on.
how they don't get
and
enough
she-
water and kidneys and all that. So I have 2 cats that are like in and out all day long. They're killers.
Hydrocare?
Yes.
Yeah.
I have
And
Nelson on it.
they're addicted to it.
Yeah,
They're-
that's what
oh my
Nelson.
God.
Yeah,
They're
my
like
Nelson's
one an
also.
Oh, he's on it.
They want
Oh.
like an olive, and it's like a martini. Honest to God, they're like, yeah, and they only get kibble.
Yeah, so my cat, being Nelson, refuses to drink water, like to the point where it was a
Well,
year
see?
he didn't drink any water, and I was like, I feel like I went to like, why is he not passed away? This is very disturbing.
Yeah, he's not a drinker.
Not a drinker.
But
So
this
what I
stuff-
do is I
it
use the
tastes like
Hydrocare.
Yeah.
It tastes like liver, I guess. I'm
I
not
don't know.
tasting
I'll
it.
have
Let
to
me
put
tell you.
sugar in Nelson's, otherwise he refuses to eat it. If drink it.
I mean, it sounds like a great product. I mean, it really does. They're using that in place of sub-Q fluids, and
Yes.
anything in place of sub-Q fluids, in my book, is
Amen.
fabulous.
Yeah.
Yeah.
Exactly right. And I am a big fan of that too. And I did ask like one of the reps about it. They're like, yeah, it helps with like everyday hydration. It's not gonna, if you're dehydrated acutely and you need to replenish,
Right.
Right.
it won't work. So,
Yeah.
that's
You
what
can't overhydrate with it. Right.
rehydrate. But yeah, so that's what I do with Nelson. Cause he's a bad drinker. And it just, like you said, Janet, like these kitties, like will not drink. But I like that you call it a kitty martini. So I now
call
have
it
my
kitty
martini
martini.
and the kitty martini at the same time.
But here's the thing: I have to start giving it kind of randomly because they're getting very demanding for it.
Oh my
I'm
gosh.
telling you, it's an addiction here.
Yeah.
It's like that heart-to-heart episode where they had the addictive stuff in Freeway's food.
Oh.
Nobody remembers that.
No, he became Atticus, who can't stand me, the male cat. He was
Right.
becoming very like coming up to me like, "Where is it? Where is it?"
Wow.
And I just finally said, "We're going to take a little breaky poo from this because
Oh, and you know what, Kelly? Janet's cats are also on, what's the clear?
that Purina, I don't know, it's anti.
Her family's cat allergic. So it's that
yes.
Live Clear
Clear.
diet, which reduces the allergenicity by 40%.
Yeah. Is that
I
cool?
think it's fabulous. And personally, I don't think they ever marketed that well because
It
you
works
just don't
for
hear
my
about
house.
it
It
anymore.
works
and
in
it
my
worked in
household.
your house,
It
right?
does. It's
Yeah.
amazing.
I mean, that's great. I mean, if that could keep a cat in the home that, where someone has a
Yes.
movie, that is yeah, I've heard
Yes.
about that that food, and I've never heard of anyone using it. And I wish
Right.
people, but I'm glad to know it works. That's great.
It does
Yeah.
work. Kelly, this has been so informative. Thank you so much.
Oh, it's so nice meeting
I'm
you.
still
It
visualizing
really
that.
was. I'm like a fan now.
Oh, well, I'd love to come back. We could talk more.
Well, the
I
other
would love
thing is
that.
You have a 415 area code, which is like coveted in the Bay Area.
Really?
I
That's so
had
funny.
one. Yeah, you can't get them anymore.
So
Oh.
after I moved to Pennsylvania, we moved here 2 years ago, and I moved I started my vet clinic in San Francisco area right before the pandemic. And after I'd worked in big rehab centers, and right before 2020, I was like, I want to start doing my own thing. And I started mobile. I got my 415 number. And then when I moved my business to Pennsylvania 2 years ago, I just brought my number with me.
Yeah.
So I started
Yeah.
415. So
Where was your business? You were mobile?
yes.
But
And I
did
served
you?
San Francisco all the way down to Palo Alto.
So I lived in Menlo Park.
Yeah, that was my serve. I had quite a cute little Frenchie, and actually this Frenchie lived in Menlo Park. So I had a lot of dogs in the Bay Area, and I still actually, for my dogs that I had a couple patients who were just wanting to maintain fitness programs, so I do virtual fitness programs with them.
Wow.
Yeah, so I
Oh,
lead
cool.
through about half an hour dog exercise of parents. Lead through the dog exercise. I don't do it for any new clients. It's just dogs that I've known
Yeah.
and worked with for years. But
Yeah.
it was great.
But Kelly, thank you. This has been a
Yeah,
pleasure.
thank you.
Golfers always swing for the greens, but they don't always hit them. Every year, millions of innocent golf balls are recklessly sliced, chunked, and hooked without any consequence. Golf balls can have a significant impact on the environment if not properly removed from ponds and water hazards, harming aquatic life, contaminating water, disrupting habitats, and aggravating golfers. Plus, golf balls do not biodegrade and can take 100 to 1,000 years to break down. Once they do degrade, they release microplastics, zinc compounds, and rubber fragments. That's why Froggy's golf ball retrieval service is so valuable to the sustainability of golf courses throughout the Midwest. Froggy's efficient retrieval system helps reduce environmental contamination, waste, conserves resources, and enhances the golfer's experience. Plus, they offer financial benefits. Froggy's pays per ball for any golf ball pulled from your ponds, no matter the condition. Don't use a mulligan. Let Froggy's clean up your ponds while the golfers clean up their game.
Hey, thanks for watching.
and listening.
We like likes.
Don't forget to like, share, and subscribe. You can follow us on social media at Speaking of Pets.
And give your pets a big kiss from the Novotny sisters.
This episode of Speaking of Pets has been sponsored by Froggy's Golf Ball Retrieval. Don't use a mulligan. Let Froggy's clean up your ponds while the golfers clean up their game. The Speaking of Pets podcast is an SLA Video Production.